Good morning or good afternoon, everyone. We're just letting all the participants in, so we'll start momentarily. Okay, I'm seeing the numbers slow down. So for the sake of time, we'll get started and other individuals will join as they become available. So welcome everyone to the first of four webinars in a sustainability webinar series. My name is Katie Clow, and I'm part of the National Issues Committee of the Canadian Veterinary Medical Association, who has an environmental working group and a national sustainability veterinary initiative, which the sustainability webinar series is a part of. So the Canadian Veterinary Medical Association, as well as the Canadian Animal Health Surveillance System, have paired up to sponsor this series of webinars in collaboration with Veterinary Sustainability Alliance. And I believe Dr. Duncan and Sandra will introduce Veterinary Sustainability Alliance a bit more, but this is a nonprofit organization that exists in both Canada and the United States to really infuse sustainability into the veterinary sector. And so this is a great collaboration today between three organizations that really want to move sustainability forward in the veterinary profession and provide the tools so that veterinarians can do this within their own practices. And so it's my pleasure to introduce our two speakers today to kick off the webinar series. We have Dr. Duncan, Colleen Duncan, as well as Dr. Will Sander. So I'll give a brief introduction and then hand it over to them to take things over. So Dr. Duncan is an epidemiologist and pathologist and has studied an array of diseases in wild and domestic animals, and really all the time wishing that there could be fewer sick animals. And this perspective and inspiration drawn from working with passionate future veterinarians has led her to shift her focus to protecting the environmental determinants of animal health. And so Colleen's work has really focused on sustainability, particularly in the educational space. Dr. Sander is passionate about sustainability and wears many hats to get things done. As an educator, a clinician, and a policy champion, Will finds synergy across animal health sectors and breaks down silos. He's a steadfast supporter of veterinary students and believes education is the foundation to reset expectations for what sustainability can be in our profession. And both Dr. Duncan and Dr. Sander are founding members of Veterinary Sustainability Alliance. So over to you.
All right, thanks for that, Katie, and thanks to everybody for hosting this webinar series and making it happen. As Katie mentioned, this is the first talk in a series of four, and our goal here today is really to kind of introduce the framework, get everybody on the same page with sort of a foundation in environmental sustainability and what it might mean for our profession. Subsequent talks are going to build on this that we're presenting here today with a few more applied tips and tricks and things people can do in practice. So just really briefly, want to highlight the connection between our profession and the environment, and why the sustainability framework is applicable for veterinary medicine, as it is with so many other professions and sectors around the world. And finally, highlight many of these opportunities for expanded sustainability efforts in veterinary medicine. Now, I know attendees on this call are probably all well aware of the connection between animal health and the environment. I think this is something that in the health sectors is probably comes a little bit more naturally for veterinarians than perhaps some of our human health colleagues. And that's because the relationship between the environment and animal health is also ages old. We think thousands, hundreds and thousands of years ago, even our nomadic pastoralists who would move animals around on different ranges, in part to manage access to nutrition, but also strategies that have been shown to be really effective in parasite management. There's also a number of examples where animals have been used as sentinels for human diseases that can come from the environment. One of the most classic is obviously the canary in the coal mine, but we also Also think about things like the dancing cats, mercury exposure in dogs and cats that were eating fish that had high levels of mercury, because those animals were a sentinel for the risk potentially posed to humans from what was in their environment. And as veterinarians, I think most of us receive a pretty solid foundational education in epidemiology and preventative medicine. And the framing that we often use for our introduction to animal health and environmental health, that sort of codependence and relationship, is the determinants of health model. And you can see on this slide, this is the human social determinants of health graph or image, which has actually recently been updated to include the green circle in the background, which shows how the determinants of human health as they move outward in those concentric spheres starts, with what we're born with, our genetics, things that we can't necessarily change, moves into our communities, our built environment. But all of this is superimposed within the global ecosystem, and things that affect that global ecosystem affect the health of all within. So I think for veterinarians and other animal health professionals that we work with, this sort of base understanding is something that we learn early and we continue to see examples in as we move through our profession. But what we have started to see is this really renewed concern for environmental health and what that means for animal health and what that means for our profession. If you haven't already read it, I would like to introduce you to this top article written by Craig Stephen. It's published in the CVJ. It's actually a pretty quick read. This came out in, I believe, 2019, and it was kind of a call to action. The importance of veterinarians engaging on climate change and some of these environmental issues. The framing for this one was that action is needed to retain social relevance. It's a quick read, and it's definitely a piece that makes you think. But there's additional work that's been done beyond just calling veterinarians to action. There's been some survey work. The second article is a publication that surveyed veterinarians in a number of countries. The majority were in the United States, but there were veterinarians from around the world, and asked about, what do you know about environmental change and climate change, and what are you concerned about, and what do you want to work in? And overall, this work highlighted that veterinarians were indeed concerned about these environmental hazards. These concerns are growing. And the biggest piece is that they didn't learn about this in school. And so how do you get this information, and what should be done? What can they do to help address this crisis? Katie mentioned that many of us on the call here in the presentation are academics ourselves. And so another cohort that I think it's really important to shout out here are our students. So if you, the survey that was done that I first shared was done for veterinarians, people out in practice, but similar projects have also been done in student populations. And I've highlighted a couple of publications here. And this group is even more concerned. And that's not really a surprise, right? If you think about generational changes and beliefs around climate change and environmental hazards, we're seeing more and more concerned younger people. And that makes a lot of sense. They didn't make these decisions, but they're certainly the ones who are going to be shouldered with the burden of dealing with it. These studies have also highlighted that students and recent new graduates, they believe that it's an animal health issue and that threat is only to increase in the future. Some risks more than others, and it really depends on where you live. But this is something that our future professionals expect to be dealing with more and more as time moves on. And the final piece, and this is really highlighted in the second article, is the importance of learning by doing. Veterinary students want to go out and model best practices in their own work, but they're not really seeing it in their teaching hospitals and the spaces where they're exposed to some of their foundational skills. So this was a real shout out and a real call to action for our academic partners about the importance of getting this type of material into the curriculum, but even more important, modeling it, right? Demonstrating best practices of behavior. And we see actually that students have taken this one level up. This is a pretty new initiative, the Planetary Health Report Card. And effectively what this is a student-led initiative where students evaluate their own institutions and try to drive change. So this started in medical schools. It's now expanded to a number of the allied health sectors, including the first Planetary Health Report Cards that came out for the veterinary schools. So the pilot project, which was led actually by Katie on this call, had only a handful of institutions, but this is increasingly adopted. So not surprising, in this area of climate and environmental health, we really see some of our young people driving change and have been great change agents. But overall, in all this work that's been done sort of on the backstory, what is known, what is not known, and what do people want to do, the overwhelming response is that people want to practice this great profession in the least harmful way. And I've got on here, unfortunately for veterinary medicine, we don't have an overview of the environmental footprint of our care, the care that we provide. But there is a lot of data in human healthcare sectors. And not surprisingly, healthcare in general is extremely resource intensive. In fact, healthcare emissions account for between 1% and 5% of the global total greenhouse gas emissions. And there was a really great study published in the Lancet fairly recently that looked at different countries. And so these are some of the stats for Canada. The Canadian health sector produces approximately 33 million tons of CO2 equivalents every year, which is about 5% of the country's total, produces hundreds of thousands of tons of other pollutants. And the healthcare sector alone is responsible for somewhere in the neighborhood of 25,000 disability adjusted life years, with a pretty huge range. So effectively, this means that the care that we are delivering has environmental impacts that themselves cause more harm. I think the most interesting and saddest part of this study is actually that there's also no correlation between the environmental footprint of the care that's delivered and the quality of care that's received. So collectively, this has really driven change in the human healthcare system because, of course, being able to attribute a certain number of death and disability to the healthcare system itself is a huge problem. So we've seen healthcare professionals really rise to the challenge around climate and other environmental hazards to try to be leaders of change. And another place where we're seeing concern is in our clients. So these are just a couple of studies that come from the pet food industry. And I think it's actually kind of interesting that actually it was just in the last couple of years where the overwhelming majority of consumers of pet products now expects or is looking for sustainable options. And that's relevant for us as people in the animal space in general. Because this again is this younger generation, also increased awareness on everybody's behalf or on everybody's part. But this consumer market is really driving change within the sector, the pet health or the pet food sector and the pet industry sector. And so there's only one study looking at veterinary medicine, but the results are actually the same. And I've included QR codes for articles that are open access that might be of interest to people on this webinar. This was a survey, it was done in the United States, but it was a survey of companion animal owners who routinely do use veterinary services to see sort of what the expectation was around environmentally sustainable practices and knowledge around things like climate and health. And overwhelmingly, more than 75% of respondents see climate and the environment as something that affects the health of their patients or of their pets. And there is a really strong expectation that veterinary teams would be knowledgeable and that there would be programs in place to provide education for veterinary teams to be more sustainable in their work and know about that animal environment connection. And finally, the respondents articulated that they value teams with specialty training. And by value, it's not just sort of on a multiple choice. Do I value it? Yes, no. Am I more willing to go to a veterinary clinic that has done some sort of sustainability certification? The answer is yes. But they're also, at least in this survey, were willing to pay more. And I circle here that it wasn't just the lowest amount to pay more, but it fell in the bin of 6 to 10% more for services provided by a veterinary clinic that prioritizes environmental sustainability. And that too is in keeping with sort of this consumer market for services that are more sustainable. So what are we to do about it? Climate change is just one of many hazards that faces our profession. Our profession is really going through a number of shifts related to things like staffing and well-being and things. So how do we pull this sort of complex, wicked problem into a framework that we can move forward and find some solutions that work into our sort of professional mode of practice and way of operating? Well, thankfully, we're not alone in thinking about how to deal with this problem and how to rise to these challenges. In fact, we can look to other systems, for example, the United Nations, and their definition of sustainability. So this sustainability framework, I think, is strategic, and Will and I are going to kind of go through some examples about why it's helpful to address these interwoven environmental and social problems that we face. But I just wanted to include here the definition of sustainability. This is from the United Nations. It is that sustainability is maintaining the Earth's environmental quality, functionality, and services to meet the human needs of today without compromising the needs of future generations. And it's really that future generations bit that I think is most key. We're thinking ahead. We're not just dealing with the problem in the here and now. We're thinking about what we are leaving to the next generations of both our people, but also the animals that we all signed up to champion. And another thing that people talk about when we think about sustainability is this three-legged stool. So it's not just about the environment, right? We need to balance sort of economic and social issues when we come up with solutions and try to drive change. If we only address the environmental piece without thinking about what some of the costs may be, social costs or financial costs, we're going to tip that stool, and it's not going to be a long-term strategy. So the United Nations has come up with these 17 sustainable development goals. And these, if you look at them, may seem a little bit overwhelming for our profession. It includes things like reducing inequalities or, tackling gender equality seems like a pretty big lift for our profession alone. But thankfully, there's been some really great work done by an organization in the UK called Vet Sustain. So in about 2020, what they did is they actually took these 17 sustainable development goals and they rearranged them into 6 veterinary sustainability goals. And we're going to go through these here really briefly today to present a bit of a foundation for the future webinars. So I just want to draw your attention to the top 3, warming, waste, and wildlife. These are actually often referred to as the triple planetary crises, climate change, global pollution, and biodiversity loss. And then we've got water, welfare, and well-being. So we're going to go through each of these individually, and obviously the intention here is not to cover each of these exhaustively, but more to highlight some of the examples of the problems that are being experienced in these domains and also some of the solutions. So I'm going to start with climate change, and I think it's beyond the scope of this webinar to dig really deep into climate. This is probably the issue we're most aware of. And I really like this framing by Kimberly Nichols, who also authored the book Under the Sky We Make, which is a fantastic read. Climate Science 101, it's warming, it's us, we're sure it's bad, and we can fix it. Pretty much you can hit the it's warming, it's us, we're sure, just by drawing your attention and reminding you of the IPCC reports that come out. This is publications, a synthesis work done by hundreds of scientists, excellent scientists around the world who contribute to these and kind of provide these synthesis reports. And so this particular one, published in 2021, highlights the it's warming, it's us, and we're sure piece. We've all seen some sort of graph like the one on the bottom, but it was really this synthesis work from the IPCC that highlights the human-driven nature of climate change and the associated extreme weather events, heat waves, rainfall, droughts, more frequent and more severe. It's bad, and it sure is bad. One of the quotes I pulled from the IPCC report is that climate change is already affecting every region on Earth multiple ways, and the changes we experience will increase with further warming. And it's bad for animals too. So there's a YouTube video on the Veterinary Sustainability Alliance website that kind of goes over this. But the effects, the health impacts on animals due to climate change are actually pretty well classified now. They're classified according to these exposure pathways: increased temperature, extreme weather events, air pollution, vector-borne disease, impacts on food and water, and also animal welfare. Will's going to talk about that last one in a bit more detail. And all of these climate change exposures are superimposed on the conditions in which animals and people reside. So we think about the physical environmental conditions and the social environmental conditions. Obviously here, I'm joining you from Colorado. I don't worry about sea level rise, and I'm not experiencing ocean acidification effects every day, but we sure have an awful lot of fires and air pollution. So we think about those physical conditions where animals reside, the types of things they'll be exposed to, but also the people who care for them and their ability to protect animals from those risks. And the last piece under climate is a reminder that we can fix it. But particularly for climate change, time is of the essence. Most studies show that the now, our decisions now, what we decide in the next decade is absolutely critical to what type of planet next generations will be inhabiting. And the only strategy or the real focus here is reductions in greenhouse gases. And we're starting to see this already in veterinary medicine. There'll be much discussion in the subsequent webinars on this, but you see a lot of efforts in the veterinary community, not just to be to expand climate literacy, but also to come up with solutions, whether they're on building or being champions for things like clean energy in their communities. The second VSG is wildlife, or really nature. And this is the one that I think is actually a really sad miss by the veterinary profession. The most recent Living Planet Index shows that approximately over the past 50 years, the average size of wildlife populations has shrunk by about 73%. There's problems with this index, absolutely, but no matter how you slice it, even if you cut it in half, this is a devastating loss to our wildlife and our ecosystems. And this is not borne equally. It depends. Some areas around the world are more affected than others. And those drivers are the ones that we would anticipate. Overwhelmingly, habitat loss and degradation for urban expansion and also agriculture production, including animal agriculture, overexploitation of species, invasive species, and far less common, although it gets a lot of press, are disease issues. In this report, they also talk about how these declines in wildlife populations are a bit of an early warning system, and certainly can help us focus our efforts around environmental protections in target areas and areas that allow a little bit of buffer or additional resilience against things like climate change. Finally, the report highlights that there are existing frameworks, but there's shockingly little progress on some of our biodiversity goals, despite the scientific consensus that they are indeed a serious threat. And this is a great photo just to add in and highlight when we think about veterinarians' role, is that if you look at the weight of animals on the planet, wild animals actually only comprise about 6% of the combined weight of mammals. So we actually have a fair amount of say in that domestic animal population as great communicators and knowledge brokers. So the opportunity to enlist change in this space, I think, is great. There's also a really strong connection between nature and health. I'm not going to go into this in detail, but things like pollination and food safety and security, access to medicines, the number of medicines, modern medicine that actually has some sort of source in the natural ecosystem is well over 50%. These systems are a great source for carbon sequestration and also doing things like cleaning our fresh water. And as I mentioned earlier, there's huge interplay between biodiversity and climate. So if we can't control climate, the effects on the wildlife populations are really much more severe. This is from the United Nations, and it talks about which % of mammals will lose more than half of their habitat if we can't halt climate change before it gets too high. But the good side of this is we now have strong scientific evidence that conservation, just protecting those natural spaces, is overall successful. Not always, there's a lot of nuance about biodiversity, but in general, if we can protect the habitat and the natural spaces for animals to thrive, those conservation efforts are successful to halt the slow biodiversity declines and in some cases reverse trends. And I originally have a series of slides about all sorts of crazy graphs, but I traded it out just to put this in. I recently was in some classrooms in Sitka, Alaska, talking about animal health and some wildlife health issues, and this was just one of the letters, right? If we think about our role as trusted messengers and champions of animal health messages and animal protections, especially to things like to groups like young people, veterinarians are really great health messengers in general, make a great connection. And I think there's a great chance for us to sort of champion this biodiversity issue and help raise awareness and drive some change. The last of the wicked three is the waste and pollution issue. Pollution is well recognized as the largest environmental cause of disease and premature death. There was a landmark publication in 2018. The data was up until about 2015. And many of you, I'm sure, saw some of the press coverage. 9 million people and trillions of dollars every year due to pollution. And the overwhelming burden there is air pollution. So of course, there's huge connections between pollution, particularly air pollution, and climate change. And this report was kind of intended as a big call to action, and highlighting a number of opportunities where synergistic work on climate and pollution could be really helpful. Unfortunately, The Lancet also just recently released its 2022 Pollution and Health Progress Update. And unfortunately, despite the sort of damning report that we saw a few years ago, there's been really an overall improvement in pollution response and bringing down levels of pollution. Indoor air pollution has improved, but ambient air pollution, outdoor air pollution, often driven by things like wildfire smoke, is increasing and projected to continue increasing. Huge socioeconomic disparities in terms of who's exposed and their ability to seek protection. And also this report highlighted, again, these linked interwoven crises, environmental crises. Pollution is obviously a really important topic in healthcare as well. Some of the reports that I've already mentioned have quantified the impacts, things like acid rain, smog, criteria air pollutants, ozone depletion, carcinogens, all these types of things that are coming from the healthcare space. And we're going to talk about this more in subsequent lectures, but I have on the bottom left there, this is a carbon inventory or carbon equivalence from the healthcare sector, broken down by these scopes. So emissions are basically classified as scope 1, produced in your hospital, scope 2, the energy that runs the facility, and scope 3, which you can see on this picture, this is human data, is overwhelmingly the majority of the footprint of hospital emissions. This is the stuff we buy. And so the opportunity to drive change in this area is really huge, right? If we can clean up our supply chain and the stuff we buy, the things that we consume, this is a great opportunity to reduce not only carbon pollution or warming pollution, but also a lot of the things that make our teams pretty upset around waste and disposal. And my gem, or my sort of good news, is a lot of people really resonate with the pollution topic. This is a picture of here at Colorado State University, a trash audit we did in surgery and anesthesia with our student teams. It's actually quite a lot of fun. It looks fun in the picture. It was fun. Oftentimes, my resident says trash is like the gateway to climate action. So people are really worried or upset about how much waste there is, and it's a great time to sort of dig in and start a sustainability journey with your team. There are things we can do. There's things we can do right away, and it often brings people together. And the last one I'm going to talk about before I pass things off to Will is water. I'm not going to spend a lot of time here because I think veterinarians in some communities are pretty tied into water in some ways. It's also one that has a few solutions that are pretty easy to grab onto. So there's a lot of literature out there about the types of changes we're seeing in water associated with environmental change, and they broadly fall into these 5 bins. There's not enough water. Water is contaminated. So compounds that leach into water, but also so both naturally and also pollution. Infectious diseases or pathogens concentrating in water, flooding. So these sort of unpredictable rainfall events, you get not enough and then overwhelming, causes huge problems. And that challenges oftentimes our infrastructure. So oftentimes these sort of extreme weather events will wipe out our existing resources that were designed to protect and filter water and those types of things under a certain environmental condition, which is not where we find ourselves here today. But I do want to call your attention to a couple of sort of weird things. Well, first of all of those things affect animals. These are just a couple of screenshots about recent. One is here in Colorado, toxic or harmful algal blooms happening in places they don't normally happen. This is a huge animal health issue because it typically is a dog that jumps in and gets sick first. Also, these sort of wildlife die-offs. This is an example of one associated with drought, but everything in those 5 bins can affect animals just the same as it can affect people. The really unique and wild ways that I think it's important for veterinarians to champion the water issue is that we literally care for life below water, which is one of these sustainable development goals. This is where I think we diverge a lot from our human healthcare colleagues, is that somebody needs to have a voice for animals that live below water. No people live below water, so you don't hear as much about this from the public health community. So we think about things like, our endangered sea turtles. Warming water means that there's temperature dependent sex determination in turtles. So overwhelmingly, the number of turtle eggs are hatching as females, and that's not good for species that are already at risk. Or the other great example, coral. These are living. They are living animals, and a topic I try to emphasize that veterinarians should be concerned about. So ocean acidification has really led to, these big coral die-offs. And some models predict that without really drastic intervention, we might have lost all of, or about 90% of the corals by 2100. So these are pretty significant animal health topics. There are some successes. I think that overwhelmingly, there has been really elevated public awareness about the importance of water. Lots of educational campaigns around that. You see lots of water saving programs in urban areas, as well as in the idea of water being out there somewhere on the landscape that you can't see. And the other piece is there's a lot of technology advances. Sometimes you don't even have to think about it. Put aerators on your taps, right? There's new infrastructure is being built by and large to be water wise and conserving water. So this is one area where we do have a number of technological solutions that we can lean into and adopt and make it a little bit simpler. So with that, for the last couple of goals, I'm going to pass the torch over to Will, and we're happy to take any questions on this at the end.
Great. Thanks, Colleen, for that. I have two more goals to go through before we can take a quick pause and then regroup a little bit and talk about kind of where we're going after that. So as Colleen mentioned, these last two goals are welfare and then finally well-being. So welfare really is thinking about this good life for animals, right? And how do we safeguard and advocate for health and welfare? Obviously, one of our main objectives as veterinarians. And the definition here of animal welfare is the state of well-being and condition independent of human expectations or desires for their prosperity. And so I think it's important to keep that in mind, right? That we're not necessarily talking about animal rights here, but we're talking about welfare and what does that look like if we were to separate humans from what's going on here. And the challenge is how do we tie welfare to climate? I think these last two goals are some that we might think about if we think more deeply about how this ties into sustainability. But it is a little bit challenging, I think. And so this review that was done last year actually looked at what number of studies out there use animal welfare framing to discuss climate change. And so they did a Prisma literature review and looked at over 4,000 studies and only found 2 of them that actually used animal welfare to frame this discussion. And so I think that's important to think about, that there's a gap here and how we can talk about this and move this conversation forward. And then obviously in the 17 Sustainable Development Goals that Colleen mentioned earlier, animal welfare is not explicitly called out anywhere there. However, another recent study tried to look at what are the 169 target areas within those 17 Sustainable Development Goals, and found that over a third of them were relevant to animal welfare by polling different experts in the area. So again, it's not necessarily that it doesn't matter, it's just not as explicit and something we need to be mindful of. Next slide. So what does this mean for us? I think there's some obvious connections, thinking about improving welfare of food animals. We know that if we improve welfare, and there's been a lot of work in this space in the last 20 years, we can have better production numbers, like more meat, more milk, and more eggs. But it also means improving product quality too. So it's not just about quantity, but also improving the quality, which in turn then decreases our food losses and waste. And so it feeds this kind of cycle in place that if we improve some of the welfare standards, that has downstream effects on sustainability and what sort of losses we have on the other side. And then we have some more indirect effects that maybe we don't often think about as closely. Colleen just mentioned about being an advocate for life underwater. If we reduce plastics, for example, in our healthcare space, that has benefits for fish and other aquatic wildlife and welfare, as well as the environment itself. And even thinking about how we modify approaches to grazing can obviously reduce soil loss, improve carbon sequestration because of increased biodiversity, and increase the diversity of soil biota in and of itself. And so you can see these connections have a strong place within the Sustainable Development Goal framework. Next slide. So when we think about this backing up just a bit, we have kind of the two frameworks that are out there about the 5 freedoms that I think many of us covered or were talked about at some point in veterinary school, that came out back in the 60s from the UK Farm Animal Welfare Council. And this idea of freedom from hunger and thirst, from discomfort, from pain, injury, or disease, fear and distress, and the freedom to express normal behavior, right? And that's evolved a little bit in a slightly more recent framework, although now 30 years old. David Mellor and Cam Reed talk about how these 5 domains exist. And you can see the overlap here, and that's what this image on the right is showing about how these 5 domains fit into the welfare state of animals around nutrition, physical environment, the health of the animal, the behavior, and how that feeds into the mental state of those animals. And so this framework is utilized quite frequently now, for example, in European Union legislation, and so something that we need to be mindful of. So I thought trying to put some actual tangible examples here to what we're talking about within welfare. And so these next few examples are pulled from a review paper done in 2023 by Joseph et al. And so one of them I thought was a great example here from Norway lobsters and thinking about crustaceans and invertebrates. And so there's been a lot of work in the last 30 years about thinking what sort of stress, how can we measure stress or distress in some of our invertebrates. And so there's a crustacean hyperglycemic hormone, and they found in Norway lobsters that if they're parasitized by certain dinoflagellates, or that they're exposed to heat shock or osmotic stress, or going through molt, that this hormone level increases. And so it's a very solid indicator of potential stress or poor welfare. And then also the correlation has been found in papers looking at heat shock proteins and muscle analysis, so that if these lobsters are undergoing stress, that it's going to affect the meat quality too from an economic standpoint. Next slide. So sea turtles, Colleen mentioned sea turtles earlier with thinking about sex dependency on temperature, but another impact of environmental temperature on sea turtles is that one of their primary diet sources, particularly as juveniles and young adults, is seagrasses. And so there's been some great work in the last decade looking at the distribution and quality of seagrasses and how much they're dependent on environmental temperature. So as we see sea and ocean temperatures increase, that actually changes the nutritional composition of these seagrasses and therefore has welfare impacts on sea turtles. Next slide. So then we talk about some flying foxes here. So this is the gray-headed flying fox. And as we all know, they're obviously a very high performance mammal and under a lot of stress already, just physiologic stress to be able to fly. And so when they're nursing or pregnant, they have even greater stress, as all mammals do. And so when they're exposed to extreme temps, the research out there has shown in a controlled setting that they have increased fanning and grooming behaviors, and that reduces the resting ability. And then there's actually a strong statistically significant correlation with increased risk of death for these individuals, which are obviously providing for the next progeny within these populations. And then finally, an example you might be more familiar with in thinking about our domestic species, but broiler chickens, work done back in 2015 by Santos looked at, what sort of impacts do hot or increased temperature conditions have on broiler chickens. And they found that there's greater concentrations of reactive oxygen within their muscle tissues and bloodstream, and it causes higher incidence of necrosis, reduces the animal's quality of life, and reduces the quality of their meat. And then a more recent paper last year, that's where this figure comes on the right, is thinking about how the impacts of climate change can impact broiler production. And you might think, well, a lot of our commercial production, particularly in Canada or the US, are under climate-controlled conditions, but we are going to be under increasing stress and challenges there about producing these animals in their climate-controlled environments and the energy sources that will be needed there. In addition, a lot of broiler chickens are still produced in many other countries around the world, not in climate-controlled conditions. And so there's a lot of downstream impacts from that for the welfare of these animals. So we'd like to try to highlight a little bit of good news under each of these, right? So this is 2 examples here, is thinking about a meat tax. So a study was done in 2023, surveying individuals in Germany, and found that there's a greater support based on animal welfare. So if we can classify why we're providing a higher tax for buying meat because it's improving animal welfare, that actually has more staying power than if it's phrased on we're going to decrease climate impact by increasing the meat tax so we don't have to produce as much meat. And so this is great to kind of funnel into the behaviors idea that Colleen mentioned earlier with how clients might be willing to pay more for services from a sustainable practice. And then Australia obviously has gone through a number of recent disasters, particularly the wildfires in 2019, 2020. And this has been a big impetus for reframing. And so, one of the other nonprofit, non-governmental organizations that's in the space around veterinary sustainability is Vets for Climate Action. And they're really trying to use this idea of, how do we motivate people from extreme animal tragedies to then reframing campaigns around climate action. Next slide. So our final goal is thinking about well-being. So, this is safeguarding and enhancing the physical and mental well-being of people and in support of transition to livelihoods and lifestyles that are fit for the future. And how do we do this not only for us, but then how does that tie into the patients we take care of? Next slide. So this is a study from 2021, a word cloud here, thinking about eco-guilt or eco-anxiety. And so the definition beyond eco-anxiety, which is a term you may have heard of, is really distress caused by climate change, where people are becoming anxious about their future. And there's a number of causes that feed into this, from environmental disasters that people either experience or see or witness, the news and information that we're bombarded with about climate change, feeling like we have a lack of control over the situation, that it's much bigger than either any of us individually can tackle. And obviously, if you have a history of anxiety orders too, you're more likely to be have experienced things like eco-anxiety. Next slide. So this idea is not just from an individual standpoint, but also how it feeds into social unrest in general. We know that from various studies and look at this that, there's an increased risk of conflicts that occur in social unrest from things like heat waves. We know through good studies work that heat waves drive heat stress associated with mood disorders, anxiety, rising suicide rates, and aggressive disorders. And then even things like floods, tornadoes, and hurricanes, studies have shown that those who are exposed to that or go through an experience like that are at more risk to develop PTSD down the road. So I think this is a big piece we need to think about. And this idea of psychoterratic syndromes is the idea of syndromes caused by Earth-related changes. And so this is a new term that's out there now in the psychological literature, and includes things like eco-anxiety, climate anxiety, solastalgia, which is distress people feel when their environment has changed, and eco-grief. And so we need to think about this as a larger social issue and not just on an individual basis or disaster-related issue. And then we do have to think about we can't just think about the negatives here, but how do we think about hope? And so the idea of hope is the perceived capability to derive pathways to desired goals and motivate oneself via agency, thinking to use those pathways, right? So eco-hope is the idea of, we have eco-grief and eco-anxiety. Eco-hope is the self-efficacy through pro-environmental behaviors. How can we mobilize those happy experiences of sifting through trash in a surgery suite, like Colleen mentioned earlier in Colorado State? And thinking more about meaning-focused coping rather than problem-focused coping, right? Hope drives action. And so if we can foster that hope, and then action in turn fosters additional hope, that will help us achieve goals and have tangible results rather than hindering goals moving forward. Next slide. So I think one of the ideas here is, this is a study looking at Merck Veterinary Wellbeing Study that many of you are familiar with. The 4th iteration just came out last year. And there are progress that we're seeing in idea around hope. And so this is looking at mental health treatment helps veterinarians lead normal lives. Veterinarians are caring towards those with mental illness. And I feel comfortable discussing mental health topics. And you can see green is the majority in all of these situations. And that's increased over time from 2019 to 2023. So that's really encouraging that we're starting to move the needle here. And one example here, again, Colleen and I are both in academic environments, but Cornell has their own 7 dimensions of well-being that they've really pushed out heavily. And a lot of vet schools are doing this. And I think this is something that we have to focus on within our profession as part of the larger issue that sustainability and climate change also feed into. Next slide. And so what are solutions here? And we're going to talk a lot about these over the next 3 webinars, and that will improve our well-being. But businesses, not just healthcare businesses, but those businesses with good environmental credentials have improved recruitment for employees, improved well-being, and improved retention. And they're often more desirable to clients too. So we need to think about the economic argument, the social argument, as well as the environmental argument. And the vast majority of veterinary professionals want to embrace sustainability, and that's from a survey done in the UK back in 2019. So what's the next step? Well, that's what leads us to the next place here, is taking action. So let's all take a pause for a second and take a deep breath. And let's talk about how we can try and take action and highlight what we'll be going over in the next 3 webinars. So first of all, we need to think about what associations are doing in this space. And so AVMA has recently adopted a new policy on climate change. And this was a push started back in 2023. AVMA has had a climate change policy in place for a number of years, but we'll say it was a little bit light in meaning and depth. And there's been a big push within the board of directors, as well as committees and House of Delegates, to actually solidify a stronger climate change policy this last fall. AVMC has a position statement on climate change that it released in 2023, which jettisoned a climate change working group after a climate change task force to how do we integrate climate change and sustainability into veterinary curricula as we train the next generation of veterinarians. And then the World Veterinary Association has a position on global climate change back in 2021. They were kind of early adopters compared to AVMA or AAVMC, not necessarily surprising. And then obviously CVMA, and I put the QR code here for the policy if you're interested in reading about that. If you haven't looked at it yet, has also implemented climate change policy too, and it's quite robust. Next slide. So, and then we talk about some veterinary sustainability groups. And so we've alluded to some of these already throughout the talk. Vet Sustain has been a UK organization. It's been in existence now for, I think, about a decade almost at this point, and they've been quite strong, obviously, in the UK, and they've talked about carbon literacy, developing some certification ideas within their practices in the UK. Vets for Climate Action is much more policy leaning and policy forward in Australia. Ecoveto is a group out of France that's really talking about how do we implement this at the practice level and talk about opening discussions around climate change and sustainability. And then obviously our group, Veterinary Sustainability Alliance, started in 2022, has been pushing heavily on a number of fronts, clinical, educational, and policy avenues across North America. And so we'll be highlighting over the next 3 webinars the pathway to a more sustainable clinic, which is a collaboration that was put together between Veterinary Sustainability Alliance, the Canadian Veterinary Medical Association, and the American Veterinary Medical Association, and released late last year. And so this is the sustainability image here on the right, and you can scan this QR code and actually go to explore a little more depth about this sustainable clinic. And we'll delve into this over the next 3 webinars. So let me give a high-level overview of that here. And so this is, again, that snail-like image. And that image was not just because we like snails or invertebrates, but actually how was this play into it? And we wanted to focus in first on core and get your team together and build that aspect of how you can get a coalition within your practice, whatever size practice that is, or veterinary workspace, that are on board for sustainability. And so that's what our next webinar will talk about, is how do you delve into that, assess what's going on in your practice space, and then move forward with solutions from there. So the next piece is that clinic aspect, which I think is what we often jump to, is how do we get those wins within our practice? And we'll be going through several avenues around energy and waste and pollution, procurement, and talking about that in our 3rd webinar in this series of 4. And then finally, we'll go to community and talk about not just within your practice, but how do you expand that out into your local community, within other healthcare spaces? How do you champion that from a policy standpoint, whether it's within veterinary associations or within state and even national frameworks or province frameworks too, right? So sorry, I stumbled there. I'm an American, and so I went straight to states. Colleen's laughing at me as the Canadian on here, so my apologies. But how do you span that out? Because I think policy is obviously a great way for us to have larger impacts, and we are great stewards and knowledge brokers in bringing that avenue forward. So that's kind of our overall pathway and thinking about that over these next few webinars. And so you can see that on the next slide here when we have those speakers coming up here. And it won't just be Colleen and I yammering on at you at these next several webinars. Either we'll be mixing this up amongst several of us within the Veterinary Sustainability Alliance. And so we'll talk about the core group here later this month, and then going over to clinic solutions in April, and then finally community in our final part of this series. So we want to thank you for that. And we're obviously open to questions in the time that remains and appreciate your attention throughout this.
Great. Thank you, Dr. Sander and Dr. Duncan. There is a question that's popped up in the chat. So the question is, Scope 3 emissions on the human side, employees, professionals commuting is one of the most significant sources of GHG emissions, as well as air pollutants. Can you comment on the veterinary side?
I mean, I'm happy to take a stab at it. So you're absolutely right, Joanne. And the other thing is there's a lot of different rules, right? So in the human health space, a lot of effort around reducing that patient footprint is how you can take a bus or take a train or whatever, commute in a less energy intensive way or a lower carbon way. Also, whether you can access telehealth services. So for veterinary medicine is a lot harder because you can't always take your cat on the bus and things like that. So I think that's the reason that we need veterinarians to be part of designing some of these solutions, because you can't directly extrapolate everything they've done in healthcare to vet care. Telehealth is obviously really regulated depending on where you practice as well. So I think there's a lot of differences. One of the things that's going to be covered in one of these subsequent webinars is the carbon calculator and really how those emissions are calculated. There is now a carbon calculator developed for the US, not yet in Canada, but we'd certainly like to do that. But it's a way where you can actually see where your emissions are coming from and if client commuting is a really big part of your footprint. We know that vet clinics, some are very regional and others perhaps like specialty centers, people commute from a lot farther. So even understanding the carbon footprint and what your clients are coming in for can be helpful. But there are across the board things like, is there a way for your pharmacy? Like, are people driving in to pick up refills? And is there a different way to do that? So we do have some solutions in that space already, even in the absence of having, a carbon calculator for Canada, for example, or the differences between human healthcare and vet care. There's actually a number of places where that footprint is radically different. There's also a lot more hospitalized humans than we have hospitalized animals, and the food that you feed said humans is a really big part of a hospital footprint. That doesn't really apply as much in veterinary clinics, and that's why, again, it's really important that we vetize a lot of our solutions.
And then Joanne, I see your follow-up there too. I mean, I think the other pieces you can think about too is, and we'll talk about this again in later webinars too, is how do you, for those who are on regular schedules, not necessarily veterinarians, but maybe support staff, how do you try and make sure they can line up schedules for carpooling? Can you have your client support specialist, for example, work from home and still field phone calls and do a lot of that stuff there? I know practices that do that as well. It obviously opens up more flexibility for employees too. So I think there's a number of different avenues to explore. Duncan Westworth, who you'll hear from later, his practice is champion trying to have EV charging stations, e-bikes, things of those nature too. So there's lots of other high tech and more expensive solutions. And then there's lower tech ideas too. So I think those are places to explore.
Any other questions? I see there's lots of comments in there as well that people are looking forward to the next series, which is great.
Rebecca, I see your comment in there, and I love that you're part of the program because vet techs, I think, are doing some amazing work in hospitals, coming up with some great solutions and really running a lot of the programs. So glad you're going to be able to join.
Okay, well, seeing no more questions, we're almost at the half-hour point. But thank you everyone for coming, and we hope that you can join us for our next series of webinars. Registration has all gone out through the CVMA as well as the Canadian Animal Health Surveillance System. And the webinars will also be recorded, and we're in the process. This was CE certified, the next one's CE certified, and we've put in the applications for the final two. So they're accredited for your continuing education. Have a great day, everyone, and we'll see you hopefully at the end of March.